Induction of labor is when we take somebody who is not in labor but needs to have their baby, and we help them get into labor.
There are several reasons why somebody might need to be induced for labor. There are medical reasons like hypertension or diabetes. Sometimes the pregnancy is just going too long and we need to induce the labor. There are times where the water will break and labor hasn't started on its own. And there are some rare occasions where it just is a decision that you would be making with your provider that's best for you or your baby.
Typically, inductions are performed with many different approaches. Often, your provider is going to do a cervical exam to determine what the state of your cervix is. Usually, we want your cervix to be ripe and ready for labor, so they may recommend starting induction with cervical ripening. There's two different ways that can be done, either through medications, and that will help to soften your cervix and potentially dilate it a little bit, or an alternative option would be a mechanical device, something we call a cervical ripening balloon.
And this is a balloon that is placed through the cervix and inflates on the uterine side of the cervix, close to your baby's head. And that helps to release natural prostaglandins and work often with the medication that we give at the same time for ripening to help expedite or to help make the ripening go faster and with less medication needed.
So if your cervix is ready, we might go to Pitocin, which is a medication that is given IV to make your contractions stronger and regular and effective.
And this is a medication that's very similar to the hormone that your body naturally makes, oxytocin. Oxytocin is a hormone that stimulates labor contractions, and as those contractions continue, it results in cervical change. An effective contraction pattern would look something like strong contractions every 2 to 3 minutes, and as you continue, that rate will remain the same.
So everybody's different. There are some women who we give 1 dose of a prostaglandin or the ripening medication to, and they are off to the races. Their body just picks it up and we are in labor. And there are other women who need all the doses of the prostaglandin and a ripening balloon before their cervix is ready. So the ripening process can take 16 to 24 hours, and then the active part of the induction could take an equal length of time.
Here at Overlake Medical Center, we want to make sure that you are safe during your induction of labor, and we do that in many ways. One, we are going to monitor you and your baby very closely. We're going to be monitoring the baby's heartbeat, and we are also going to pause on regular intervals to check in with you, the whole healthcare team, to ensure that you feel safe and well cared for. Team birth is about communication, teamwork, and making sure you are truly part of your care, not just a patient, but a partner in every decision. You and your support person, your nurse, and your provider are all part of the team. There is a whiteboard, also known as a shared planning board, in the room. It shows who the care team is, what your preferences and goals are, what is happening with labor right now, and what are the next steps. Team birth is one way we get the whole team on the same page, and most importantly, you.
Many people have, friends that said they went into labor on their own and they didn't need Pitocin and they were able to have a birth that wasn't painful. And they're worried that when we talk about induction and medication, and specifically Pitocin, that we're going to give them more pain. Pitocin is used specifically to increase the strength and or frequency of your contractions. And we only use it for that purpose. So if you need Pitocin, it's because your contractions are not strong enough to produce cervical change, and now we're giving you the Pitocin to help those contractions become effective. I think women dream about the birth of their babies often like they dream about their weddings when they're young, right? And so sometimes you have to take a minute and process and consider that your birth may not look exactly like you had planned it, but that ultimately we are going to give you the best experience and hit as many of those notes as you are hoping for, while at the same time keeping in mind our goal of keeping you healthy, keeping your baby healthy and safe.
When you come to Overlake for your induction, you can be assured that you've got a highly qualified team who's here to ensure a safe and positive birth experience for you and your baby.
This is a hospital where you can have your cake and eat it too. You can have a medical induction and still feel like you're going to get the birth experience that you were hoping for.
I know our team at Overlake Childbirth Center is excited to have you come and have your labor with us, and we hope you're excited too.